Hi, Torna.
Hi, Jen. How's it going?
Great. Thank you so much for joining me today for this video on the winter blues and the holiday blues. We definitely get a ton of questions about both during this time of year as we enter into the winter months and the holiday season. And so really this video is to help people understand what that experience is, but also really to help normalize the experience because so many more people experience either or both the winter and holiday blues during this time of year. So let's start with the winter blues. Can you tell us a little bit about what it is, what people might experience if they go through that phenomenon?
Yeah, absolutely. I'd be happy to. So winter blue typically comes on set when it starts to get cold, the chill is setting in, with daylight savings, there's less daylight. And oftentimes the symptoms that can occur can look like fatigue, really tired, just not really motivated to get out of bed. I know for some folks, they might just want to huddle in and hibernate, all winter, even carb load, right? Get on all the pastas and just settle in. Although I do want to say that with winter blues, it is different from seasonal affective disorder, which is a subtype of major depression. It is more severe, and it does impact negatively, more significantly for individuals. Research shows that 6 out of 100 individuals will experience seasonal affective disorder, but 14 out of 100 will experience winter blues. So it's actually more common than we think.
That's super common, yeah, absolutely. And so, winter blues, seasonal affective disorder, that's different than the holiday blues we're talking about both today because they both occur around the same time of year, but they're different. Certainly someone could experience both at the same time, right? So with holiday blues, it's just what the name says. It's blues around the holidays. And while most people, they experience cheer and joy and a sense of belonging around the holidays, other people, they experience stress. And it could be obviously stress and feeling overwhelmed, but depression, anxiety, loneliness, grief, sometimes irritability, and it's really challenging. What triggers those feelings is different for everybody, right? Depending on their circumstance. So for some, it might be just being away from loved ones. So that feeling of isolation, feeling lonely. Sometimes if you have loved ones who have passed in the recent years, those wounds can be more tender around the holidays. It can be really hard, that grief reaction. And then for others, it is the stressors of the holidays. So the commercialization, that pressure to gift give, spend a lot of money, which can be really hard if someone's going through a financially difficult time or just all the social gatherings and everything you have to do around the holidays. And I think that many of us understand the concept of having difficult family dynamics, which can come out around the holidays. Everyone's together, they're stressed. So, any combination of those can trigger the holiday blues.
So Jen, with that being said, what do we do about it? Individuals who are experiencing all of this, what are some coping skills and interventions you recommend?
It's a great question and such an important part of this video, right? So when I work with someone in therapy, and by the way, talk therapy can be helpful if that's something you think would be useful to work with a professional, I really work on developing coping skills specific to that person because it's not a one size fits all. But for the purpose of this video, let's share some tried and true coping skills and recommendations. So the first is to set realistic expectations. We put a lot of pressure on ourselves during the holidays, right? To do more, to spend more, and that includes setting realistic budget expectations as well. Sometimes folks may feel guilty about not giving more, spending more, but that's going to definitely reduce the stress level if we stick to our budget. If you are away from loved ones and you're feeling that loneliness and isolation, just really being open to discovering new opportunities to celebrate the holidays, maybe other people that are nearby that are supportive and caring individuals, and just take that moment and enjoy it. If you've lost loved ones, really thinking about ways to honor and recognize the people who have passed and being open to setting new traditions. Sometimes the person who's passed is the one who really did the holidays, right? And created the holiday tradition. So finding maybe some joy and thinking about how you want to celebrate the holidays and new traditions. And I also encourage folks to exercise. Exercise is huge, and that doesn't mean you have to start CrossFit or going to the gym, but so many research studies have shown that exercise really helps reduce all types of stress. So certainly holiday stressors, winter blues, and it can be simple things like just going for a brief walk, stretching in the morning, doing a 10-minute yoga video. Yes, absolutely. And lastly, I really coach and train folks to start practicing gratitude daily. There's lots of ways to do that, but practicing gratitude can be a game changer.
The gratitude part, that's such a good one. Jen, thank you so much. Those are wonderful coping skills. And I do want to add, for winter blues and seasonal affective disorder, one way to really combat the lethargy and aid motivation is to just be active. Like Jen said, the exercise and moving around, doing stuff, right? And the other thing is too, for individuals experiencing that, they might be more sensitive to the reduced daylight hours. So there's a light therapy that I would recommend, and it's a special lamp that you can get, and it can really mimic the early morning dawn hours, and that can most certainly help.
Torna, I think we just want to end this video by just recognizing again that this is a normal experience. So if you or a loved one is experiencing winter blues or holiday blues, and in fact, the APA did a study a few years ago where almost 40%, 38% of individuals in the survey said the holidays cause significant stress. So yeah, it's super high. So you are not alone. So definitely think about the different coping strategies that Dr. Lee and I have talked about today. And if you or a loved one is experiencing more significant symptoms, more severe depression or anxiety, please reach out to your healthcare provider or a mental health professional who can help you. If you live in one of the states that CHG services, we are happy to set you up with one of our expert and compassionate therapists who can do an assessment, help you learn a little bit about your mood, and think about just individualized treatment options for you. And if you'd like to learn more about CHG Behavioral Health Services, please visit us at www.cheservices.com.